About 9 million children in this country do not have health insurance, and Congress wants to change that. Both houses recently voted to expand the state children's health insurance program called Schip, which expires in September. Schip currently provides coverage for about 6 million children whose parents make too much money to qualify for Medicaid, but who don't make enough to pay for private insurance. Under the congressional bills, about 3 to 5 million additional children would be covered. In North Dakota, Schip currently covers more than 6,000 children, but more than 14,000 children remain uninsured. If Schip is expanded, it would cover about 4,700 more over the next 5 years. But even with this increase, Congressman Earl Pomeroy says North Dakota can still do a lot more.
The federal government is offering $4 for every state dollar advanced to cover uninsured children. And yet North Dakota has one of the smallest participation rates in the country because the state hasn't put much money out there. In fact, 41 states of the 50 cover their children more generously than North Dakota.
But that's not the only obstacle facing North Dakota's uninsured kids. President Bush is threatening to veto the combined bill because he says an expansion of Schip would force more families to rely on the government for health insurance. Instead, the president wants to offer middle-income families a tax credit to help them to better afford private insurance. But Children's Defense Fund spokesperson Ed Shelaby says the president's plan isn't the solution.
Tax credits typically leave low-income families out in the cold. And they're a lot more challenging, a lot more bureaucratic, and a lot more difficult to implement.
Shelaby is not alone in his thinking. A study conducted by MIT found that public insurance programs like Schip provide coverage to more people than tax credit alternatives do. And perhaps more importantly for Congress, they also do so at a much lower cost. From Washington, Christina Paschyn, Fox News.